Hi everyone. This video is for those who want to learn or review how to examine pupil reactions using the APD tester. Those viewing this video could be optometrists, ophthalmologists, ophthalmic technicians, or students. I will try to make it in a way so hopefully everyone can follow along. My name is Babak Kamkar, and I'm an optometrist in private practice in Southern California. My disclosures include that I'm a consultant to Good-Lite and the inventor of the APD tester. A few years ago, I thought of creating a device that I could see both pupils at the same time superimposed over each other. That's because I had such a hard time examining small, dark pupils or some post-surgical or sluggish pupils. Especially after I became presbyopic, I had to tilt my head up like this to see the patient's pupils through my progressive addition lenses. If you haven't reached that age, you'll know what I mean when you get there. Afferent pupillary defects are never considered normal. There must be a reason for the presence of a positive APD finding. So how can we be sure there's no positive APD in that half a minute or less that we are given to examine the pupil right before we instill the dilating drops? As you know, once tropicamide or phenylephrine drops start their action on the iris, it's too late for any pupil testing. We have to wait a few hours until the pupil both pupils return to their natural state. So this device called APD tester magnifies both eyes, superimposes them over each other. You need to adjust your distance to the correct position relative to the patient. You would see the two eyes side by side, overlapping, or fused into one. Some clinicians may have a mild amblyopia or suppression or some other binocularity issue that could prevent them from seeing the two eyes equally well. If the amblyopia is not severe, the device still works for these examiners as well. To begin the test, the examination room should be dimmed to the level that you could still see the pupils of the patient. The distance of the device to the patient will be about 15 centimeters or 5 inches. Hold the instrument at that distance to the patient with both hands, and then get yourself closer to be able to look through the oculars like this. Make sure you're in focus by adjusting your distance to the patient. If you see double, it's just fine. Just continue. Press the button for one of the LED lights and observe the direct response. Leave it on for about a second and then turn it off. You will see the pupil constrict, and then as you let go, the pupil returns back to its state that it was before. If you can close your own eye of that same side, then you will be seeing the other eye of the patient. In healthy individuals, this other pupil also briskly constricts. This is called the consensual reaction. Then you can shine the other pupil and look for the direct response and consensual reactions. Once you have determined that each pupil reacts normally to light, to direct light and consensual light, then you can start testing for relative afferent pupillary defect, or APD. APD testing is accomplished by sequentially alternating the light between the two eyes. Each time the light is kept on for about a second, then quickly switched to the other eye without any gap in time, like this. Using this method, you can reduce hippus and pupil release, which are part of normal reactions. If you happen to see one pupil dilate slightly after you switch the light, that would be a positive APD. It would mean that eye that dilated must have an abnormality. It's either in the optic nerve or a significant portion of the retina. It really does take 5 or 6 trials to get a hang of this device. But once you do get it, it is a better way than the swinging flashlight test. In a study published in the Journal of Ophthalmology and Clinical Research, APD tester was found to be more sensitive and reliable than using a pen light with the swinging flashlight test.